New this morning, a little over 2 years ago, Butte County Behavioral Health began a partnership with the Chico Police Department, providing trained counselors to go on calls when officers needed help involving a mental health crisis. I wanted to find out, is that teamwork working?
We're just more educated and we've received more training.
On any given day, 17-year law enforcement veteran Sergeant Paul Ratto is responding.
Always is en route.
Sometimes to crime, often though,
Chico, I'm code 4.
to someone who simply needs help.
Are you able to stand? Living on the street? Yeah, how long you been on the street?
When a call requires a more intense mental health response,
So this gentleman called the crisis line.
Chico Police bring in counselors from Butte County Behavioral Health, the mobile crisis unit.
In the past, law enforcement had very few options. It was either take somebody in or let them go. And now we can connect with them and help them get what they need to get them out of this cycle of crisis.
I spent several hours with Sergeant Ratto.
Especially with COVID-19. A change in calls at all?
Yes, we're experiencing a lot more calls for service as it pertains to people in mental health crisis.
He says working alongside counselors and because officers have increased training, they're now better equipped at responding.
The advances we've made in the last 2 years are epic.
I think our citizenry, rightfully so, is demanding that law enforcement understand people living with a mental health diagnosis. I think it only adds to our mission in keeping people safe.
And DeCamp says the program is successful. In fact, calls for services over the past 3 months up 30% from the same time last year. Sergeant Ratto says law enforcement still has much more work to do, and he says he'd like to see more departments take this kind of approach, and he hopes Chico can expand the program to 24/7 coverage.